Hello everyone. 10 years after the Supreme Court legalized euthanasia, how has Canada changed? Second, the election countdown begins in Ontario. Third, who decides when you can't? Health Canada surveys Canadians on advanced care directives. And fourth, an action item in Nova Scotia, effective referrals affect doctors' conscience rights. It's Wednesday, February 5th, and this is Quick Updates. Now, it's been 10 years since the Supreme Court changed the landscape in Canada by legalizing euthanasia. Here's John.
Hi everyone. Tomorrow, February 6th, marks the 10th anniversary of the Supreme Court of Canada's ruling in the Carter versus Canada case. That ruling declared Canada's complete ban on euthanasia to be unconstitutional. The following year, Parliament would pass legislation that officially legalized euthanasia in Canada, and since then, the law has only gotten more liberal. Now, Colin and Daniel and I, we sat down for a discussion. You'll see that video coming out tomorrow to discuss where we've come since the Carter case and where we're going, where we might go in the future and what you can do about it. So please stay tuned for that. Thanks.
Thanks so much, John. Now, the election countdown begins in Ontario. On the line, tariffs, economy, and healthcare. The problem? There's something here no one is talking about. Paul, Daniel, and I released the first in our series of weekly podcasts on the Ontario election.
I am personally nonpartisan in the sense that I don't have any stake in the survival of any of these parties. I have a stake in society that's pleasing to God and that orients people towards their earthly and heavenly good. And so if the NDP wants to take that up, I'll buy membership tomorrow.
That'd be great.
Yeah.
Be sure to stay tuned for the next one coming out next Tuesday. Go to youtube.com/ARPACanada to watch the full episode now. Who decides when you can't? Here's Daniel with more on the Health Canada survey.
Hi everyone. Even though Parliament is prorogued, the federal bureaucracy is still at work, and they've been tasked with continuing a national conversation on advance requests for euthanasia. Advance requests would allow a person to outline circumstances in the future under which they would like to be euthanized. For example, a person diagnosed with dementia can explain when they want to be euthanized, even if they can no longer consent at that point. The public consultation is open until February 14th. Please take a few minutes to fill out the consultation if you haven't yet done so. Our government needs to hear from us about the need to protect the lives of people who can no longer consent to euthanasia. Head to our website for some talking points and suggestions for responding to the questionnaire.
Thanks so much, Daniel. Now, the grassroots team has an update on an action item for Nova Scotia.
Hi everyone. How would you feel if someone asked you to do something that was totally against your beliefs and you weren't allowed to say no? Instead, if you refused, you would have to provide them the ability and resources to find a person that would say yes. Last year, the College of Physicians and Surgeons of Nova Scotia did just that. They introduced a policy which said that doctors were required to provide an effective referral for procedures that they morally opposed. This would mean doctors would have to discuss all treatment options, including euthanasia, abortion, and medical transitioning. Policies like this threaten the conscience rights of the physicians and could lead to doctors leaving the province and patients not being comfortable with the care that they receive. So today we are asking you to join us in protecting both doctors and patients in Nova Scotia by taking a moment to send an email through our EasyMail system to your elected official. It's really quick and easy, and it's so important that our representatives hear our concerns about this. Head to easymail.arpacanada.ca to send that email today.
That's it for Quick Updates. Thanks to you for watching. Please do like, share, and subscribe, and we'll see you next week.